Hello and welcome everyone to this session on 30 minutes, 30 images of pathology gross specimens. My name is Dr. Jhanvi and I am the anesthesia educator on Unacademy. And I hope that the streaming is okay. I was just having a little bit of an internet issue and that's why I got a little late. Okay, so today we are going to be discussing the surgery specimens. Okay, surgery as well as medicine. So you all must not be remembering these specimen pictures. We used to basically do it in our second year of MBBS. All these gross pathology specimens. So I'm going to quickly show you about 30 of the most commonly asked gross pathology specimens during your second year viva, which can now come for your NEET PG exam also. Okay, remember the NEET PG exam has become very practical oriented and they want to ask you all the questions that you have done in second MBBS and fourth MBBS. So chalo, le lo, okay? So these pictures basically are 30 pictures. They include the patho specimens from your laboratory that we saw in second MBBS as well as in fourth MBBS final year. Okay, so let's begin with our class for today. The Plus subscription on Unacademy will give you daily live classes, live tests and quizzes, structured courses and unlimited access using a single subscription. The Iconic subscription will give you the live classes and batch courses of Prep Ladder along with video lectures and question bank of Prep Ladder. Okay, so live classes, batch courses of Unacademy with video lectures, question bank of Prep Ladder. Then there is a NEET PG 2-month calendar that we have going on right now for complete revision of all 19 subjects. And we also have a 12 grand test to give. We have the ultra fast track high yield revision batch. And to make sure that you get all of these, you can buy the NEET PG subscription for 2 months for 6750 rupees only. We also have the Target Next 2022 batch, Professional Year 4 batch, Focus FM batch, and today is the last day for getting these discounted rates of Iconic subscription. Okay. After this, there is going to be a price hike. Introducing the 4-year subscription for 75,000, and all of you all know about this. So I'm not going to spend too much time. If you want to buy the Plus subscription, you can use my code Dr.Jhanvi Live and get 10% off on your subscription. Okay. No volume or low volume? Is it no volume or low volume? It's fine, right? So you want me to shout basically. Okay, it's low volume. Okay, all right. अभी सुनाई दे रहा है? अभी सब ठीक है? अभी ठीक है? Better है? I think I must be keeping my hand on the laptop. That's fine. Okay. All right. So this is our first gross specimen that we are going to discuss for today. So can anyone tell me what is this gross specimen of? ओके इतना हाई फंडू नहीं चाहिए मुझे मेनेथ्रियस डिजीज ये वो पहले मुझे बताओ व्हाट इज दिस ऑर्गन दैट वी आर सीइंग gross specimen of which organ? Absolutely correct. So this is the gross specimen of the stomach. How did you identify this gross specimen of the stomach? You can see there are rugosities. Okay, so stomach easy to identify. You will be having rugosities. Okay, anything that you can see abnormal in this specimen? First thing we have identified is that this is the stomach. What is abnormal? Yes. So basically you can see that there is a sharp punched out lesion over here. Okay. Sharp punched out lesion. And can you see the margins of this lesion? So margins of these lesions are rolled up or they are everted. Okay. So if you see over here, this is your example of, can anyone tell me what gross specimen are we showing over here? There is a sharp punched out lesion. I'm writing it for your benefit only, okay? So that later on, you can just download this and revise it. Sharp punched out lesion with rolled out edges. So what are we talking about over here? This is gastric ulcer, okay? This is a gastric ulcer ka specimen. Okay, now tell me gastric ulcer ke specimen mein over here, they will ask you, gastric ulcer can turn easily malignant, correct? So they will give you this picture and ask you, what is the most common type of malignancy of the stomach? Identify it. This is a gastric ulcer. Gastric ulcer can often turn malignant. What is the most common malignancy? Yes, absolutely correct. It is adenocarcinoma. Okay, now I want to ask you, malignancy of stomach spreads by which 3 routes? Spread of malignancy is by which 3 routes? One is lymphatic, very good. And give me 2 others. Yes, hematogenous and direct spread. Okay, direct spread is also called as spread by continuity. Okay, so we have identified this. This is rugosities. So definitely this is a gross specimen of the stomach. You can see over here there is a sharp punched out lesion, reddish looking, and it has rolled out or everted margins. So this is a gastric ulcer, and gastric ulcer can also often lead to malignancy. Most common malignancy is adenocarcinoma. Okay, all right, let's go on to our next specimen. Yes, very good, very good. Okay, so can you guys identify this is a gross specimen of the kidney? This is easy to identify, okay? Because kidney may you have to look at two things. One, you have to look at the vessels. So you can see there are some kind of vessels that are entering into the hilum, okay? So that will help you identify. What is the other thing that you should look for if you want to make sure that this is a kidney specimen? Yes, very good. So two things, one is ureter and the other thing is you should be able to see the renal vessels. So यहाँ पे ureter you can see over here going down, okay? And renal vessels you can see going into the hilum over here. So this is our specimen of kidney and you can see that it is fused at the lower pole. So this is a specimen of horseshoe kidney. Horseshoe kidney. Okay, how will a person with horseshoe kidney present? Any idea? Presentation of horseshoe kidney? Yes, you can, very good, formal punch. You can also see adrenal gland above. Okay, so you can see the adrenal gland above in this case. Horseshoe kidney will present with recurrent UTIs. Okay, recurrent UTIs. All right, next one. We have to finish 30 images in 30 minutes. Okay, guys, so you have to be quick about it. Okay. So what is this? Butterfly shaped gland. First of all, you should know this is a butterfly shaped gland. Okay, so butterfly shaped gland, what can you identify over here? This is our thyroid gland. Okay, now can you see anything peculiar in this thyroid gland? Can you see anything peculiar in thyroid gland? Can you see that there are these big lobules that are present? Basically homogeneous multiple lobules that are present. Yes, so these are enlarged follicles. Okay, so what is this kind of presentation called as? Any idea? Hashimoto's disease. Okay, so this is a sort of a multinodular goiter. Okay, multinodular goiter. So you can see over here, you can see enlarged lobular pattern that is there over here. So this is multinodular goiter. This could also be a colloid goiter, but mostly if you get the option, go for multinodular goiter. Okay, all right, next image. Yes, very good. So again, kidney, but could you identify that this is kidney? No, only because of the kidney shaped. Okay, because of the shape, you can identify over here that this is the kidney, but you're not able to see any ureter or vessels over here. So this is not a classical picture of the kidney. But what can you see over here? You can see multiple cysts that are present. Okay, so multiple cysts are present over here. So these cysts will basically give you the answer over here, and that is, this is your example of autosomal dominant polycystic kidney disease. Now, many of you all have said ADPKD, that's why I've written ADPKD, but it can be autosomal recessive also. The most common in mode of inheritance is autosomal dominant, but it can be autosomal recessive also. Okay, the question that they will ask you, this kind of appearance of multiple cysts can be seen in which other organs? Which is the most common organ in which you will see? Yes, so you can see it in the lung, liver, and in the brain. Cysts are seen in the lung, liver, and brain, and the most common area where you can see it is in the liver. Okay, next, what is the presentation of this disease? They'll give you gross specimen and ask you. Yes, so hypertension and two other things. Hypertension, hematuria, very good, and polyuria. Okay, hypertension, hematuria, and polyuria. Okay, what is the, so they'll give you a presentation of a patient who comes with you with hypertension, hematuria, polyuria. This is the specimen of his kidneys. What will be the treatment? What is the treatment? De-roofing of the cysts? Yes. Okay, ultimate treatment is renal transplant, but otherwise you can do de-roofing of the cysts or you can do shaving off of the cysts. Can anyone tell me the name of that surgery? You can shave off the cysts. What is the name of the surgery? Yes, very good, Priyank. So it is Rove Singh's operation. Okay, Rove Singh's operation. Yes, so that is your treatment for polycystic kidney disease. Okay. Now this, I have given you both sides of the organ, and that's why you are able to identify it. Yes, so there is a lesion over here. You can see all this is the fatty tissue of the breast. Definitely, how do you identify the breast? You identify the breast from the areola and from the nipple. Okay. Now over here in breast, they can give you only two types of gross specimens. One gross specimen that they will give you is fibroadenoma, and second gross specimen that they will give you is of CA breast. Okay. So fibroadenoma will be little more homogeneous looking, like I have shown you over here. How will CA breast present, anyone? CA breast, how will the lesion look? It will basically have many irregular margins, okay? And it will be, yes, irregular margins, and it will be ulcerated and infiltrative type, okay? Now, what is one thing that will definitely tell you that this is CA breast? Any idea? Along with the breast, they will also give you an extended sample. And what will that extended sample show? Just not the breast, but also an extended sample of the axillary lymph nodes. Okay, so they will give you an extended sample of axillary lymph nodes, and these axillary lymph nodes will be enlarged. So that will tell you that this is CA breast. Okay, can anyone tell me what is this example given in CA breast? What is this image in CA breast? Yes, absolutely correct. This is per the orange appearance seen in CA breast. Why do you get this per the orange appearance? Anyone? Why do you get per the orange appearance? Yes. So what happens is you have blocking of the cutaneous lymphatics. You have blocking of the cutaneous lymphatics by tumor cells. Okay. So because of that, the lymph, it becomes static and the breast becomes edematous and hard. Okay. So that is your per the orange appearance. What is this appearance number 2 that you can see? What can you see about, okay, anything about the nipple specifically? Dimpling, puckering is correct. Yes, the Priyank, very good. The nipple is retracted over here. Why do you get a retraction of the nipple? Any idea? Or when do you get retraction of the nipple? When there is involvement of the Cooper's ligament. Absolutely correct. So if the tumor infiltrates into the Cooper's ligament, or into the lactiferous ducts, or both, okay, that is when you get your nipple retraction. Okay, I hope my handwriting is fine, because I can see that I'm writing very quickly and that's why it's going bad. Okay, so we have seen this example. So they'll give you a picture of the breast, and then they will give you either fibroadenoma breast. Now you can see if the fibroadenoma looks more homogeneous and more as a part of the breast. If you have a CA breast lesion, it will have irregular margins and it will be ulcerative. Okay, puckering is for skin, retraction is for nipple. Yeah, Suman, that is correct. So per the orange appearance is for the skin around the areola and the nipple, and this is your nipple retraction. I've given you pictures of both and how they will look in the exam. Okay. Anyone identify the organ? Now I've given you a picture over here because it's not very easy to identify this organ. And just tell me what kind of kidney can you see over here? Yeah, this is a kidney. Is this a normal kidney? Is it enlarged or is it shrunken? It's not fused. Is it a normal kidney? Is it enlarged or is it shrunken kidney? Just answer my question. Enlarged or shrunken? Yes, so it is a large kidney. And what is the color over here of the kidney? You can see. Is it looking waxy? Very good. So it is a large white kidney. Okay, large white kidney. Sometimes you should be able to see the things directly in a specimen if they give you, and you should be able to answer. Now, if I had not given you this picture over here, how would you identify that this is the picture of the kidney? Can you see anything over here? Two things that I told you guys about the kidney. You should be able to see the hilar blood vessels. Here pe not seen very well, but you can see the ureter coming out from here. Okay, so the ureter should tell you that this is the kidney. Okay, so in your exam, yeah, it looks like an octopus. Absolutely correct. So in your exams, you will get this large white kidney. So can you tell me two reasons for having a large white kidney, or even one is okay? I will give you the other one. Okay, very good. So they will give you this picture and ask you what is the cause. So it can be amyloidosis. What is the other cause? Any idea for other differential diagnosis of large white kidney? Not diabetes, but rapidly progressive glomerulonephritis. Okay, RPGN will also present as a large white kidney. Okay, all right. Next one. Same, but this is, yes, formal pants, very good. So even in Von Kirk's, you will get a large white kidney. Yes, very good alter ego. So now you saw the large white kidney. Now you can see the small shrunken kidney. So can you give me any reason for having a small shrunken kidney? Very good. Chronic kidney disease. CKD mein mostly you will get a small shrunken kidney. Anything else? Chronic hypertension. Yes. Chronic hypertension will lead to what kind of disease? It is also called as benign nephrosclerosis. Correct? Benign nephrosclerosis. And then chronic pyelonephritis will also lead to small shrunken kidney. Okay. So kidney ke bare mein gross specimens you all have understood. I have given you 4 or 5 gross specimens. One was this was polycystic kidney. Then we did one in the beginning, correct? Which one was it? Okay, no, we have done one only till now. Yeah, so we did horseshoe kidney, then we did polycystic kidney, then we did large white kidney, and then we did small shrunken kidney. Okay, so kidney is one of the favorites for the exam, so you should know all the kidney specimens. Now, another kidney specimen. I'm telling you this is the kidney. I did not get a better picture than this, but this is a kidney specimen only. You can't see the ureter over here. But what can you see over here? No, these are not stones. Yes, very good. So this is RCC. Okay, so what can you see at the upper pole of the kidney? Whenever you have this dirty appearance, ulcerated lesions or blood bleeding over there, hemorrhagic lesions, punched out lesions, all these point towards malignancy. Okay, so always when you look at these kind of lesions, you should think of malignancy. Okay, now cut surface mein you can see that there are small brownish blackish nodular areas at the upper pole. Okay, so whenever you have this brownish blackish appearance, so you call it as a variegated appearance. Okay, this is called as a variegated appearance. Okay, now there will be a small capsule over here. Can you see over here? I have marked it. There is a small capsule around the tumor. So this is not the normal kidney capsule. This is called as a pseudo capsule. Okay, this is a capsule of the tumor, so it is called as a pseudo capsule. And if you see the posterior aspect of this kidney, which you cannot see in this picture because it's just a 2D picture, but in the specimen you can see that the posterior aspect may the Gerota's fascia will be infiltrated if there is a tumor. Okay, so understood what is variegated appearance of the kidney, all these brownish blackish nodular lesions, and there will be a small capsule around the tumor, that is the pseudocapsule. So this is a tumor of the upper pole of the kidney. Most commonly or most probably it is renal cell carcinoma. Okay, all right, next. Identify the organ and identify what is the appearance of this organ. Lung, very good. And what can you see in this picture? This is the lung, mottled appearance. Okay, this is not mealy appearance. It's very easy to get confused between mealy appearance and this. Okay, so let me zoom in on the image and show you guys. Can you see small cavities over here? Okay, what is the most common cause of cavitatory lesions of the lung? Multiple cavities you can see over here. Yes, so this is nothing but an example of cavitatory TB. Okay, so this is an example of cavitatory TB. Now about TB, I want to ask you guys one question. What is Ghon's focus? What is Ghon's focus? This is not mealy TB, guys. This is cavitatory TB. We'll come to mealy TB also. You should be able to identify between the two of them. What is Ghon's focus? Yes, Ghon's focus is the primary subpleural lesion. Okay, abhi NEET PG ki books mein and app mein, no one must have revised with you these basic things. But these basic things will come for the exam and you will start thinking about your second year pathona. Okay, so the primary subpleural TB lesion that is there, that is called as Ghon's focus. But what is the question that I'm more interested in? What is Ghon's complex? Can anyone tell me what is Ghon's complex? What are the three things that Ghon's complex is made up of? One is Gons focus, obviously, which is the primary subpleural lesion. And what are the two other things? Involved hilar lymph nodes, very good, and involved, one more thing, involved hilar lymph nodes and the draining lymphatic vessels. Okay, draining lymphatic vessels. Okay, so this is our Gons complex. This is an example of cavitatory TB. Did you all understand this, identifying the specimen, guys? So they will ask you what does it look like, and then they will ask you questions related to it. TB के बारे में पूछेंगे. Now tell me, what does this look like? What is this? Very good. Now this is mealy TB. This looks like millet shaped. Okay, this looks like millet shaped. So this over here that you can see is nothing but mealy TB. How do you identify mealy TB? You will see these multiple small white dots that are there in the lung. Can you see? Multiple small white dots. Now you can see the very obvious difference between the previous picture and this picture. I'll just erase these cavitations के ऊपर. So इसमें previous picture में very obviously you can see the cavitations, and in this picture you can very obviously see the small white dots. Okay, so those multiple punctate opacities or white dots is nothing but example of your mealy TB. Okay, and you can see the parenchyma in between the dots. The parenchyma in between the dots will be normal. Okay, so this is example of mealy TB. Now can you tell me what is the mode of spread of mealy TB? Any idea? Mode of spread of mealy TB, because you have spread of mealy TB to all different organs of the body. Yes, so the mode of spread is hematogenous spread. Absolutely correct. Okay, now next picture. This may not be a very clear picture, but still examiners are known for not putting clear pictures in the exam, so you should be able to identify. Okay, first of all, do we agree this is a picture of the lung? Do we agree this is a picture of the lung? Yes. Okay. Now I want you to focus on the second picture over here. Can you see there is a difference between this lobe of the lung and this lobe of the lung? This lobe looks more pale, ischemic, and it looks like it looks more like the liver. Okay, so it has a liver consistency in this. So what is this? Yes, very good. It is gray hepatization of the lung, and this is nothing but an example of lobar pneumonia. You can see this lower lobe of the lung, it completely starts looking like the liver. So this is the example of lobar pneumonia. Okay, now can you tell me what are the stages of pneumonia? If you want to see pathological changes in the lung, then what are the stages of pneumonia that you see? First stage is stage of congestion, correct? After congestion, what do you see? Yes, then you see red hepatization. Then you see gray hepatization. And then you see consolidation. Okay, so what stage is this specimen in of the lung? This is mostly in the stage of gray hepatization. Okay, yes, absolutely correct. So when it starts looking like the liver, you should know that this is more of pneumonia. Okay, all right, next one. First identify the organ, and then you should be able to identify what is the problem in it. Yes, very good. This is the testes. Very good, alter ego. Can you tell me, alter ego, how did you identify that this is testes or Prathamesh? Because only 2 people have identified it till now. Okay, so what do you see over here attached above? What do you see over here attached above in the testes? Very good. So whenever you want to identify the testes, you should look for the spermatic cord. Okay, so always for the kidney, I told you, you should look for the ureter, and for the testes you should look for the spermatic cord. Okay, so it looks a little bit like the thyroid gland, only it has a sort of a butterfly shape, but you will see the spermatic cord attached on top. Okay, now can you tell me what is there in, you can see some mass over here. Okay, I'm unable to see your answer. Yeah, yes. So you can see a mass over here which is blending with the margins of the testes. Is this blending with the margins? Yes. And how is this mass? It is homogeneous in nature. Okay, so homogeneous mass which is blending with the margins. So what is this? This is a seminoma. This is a seminoma. So now tell me if there was a variegated appearance, okay, all those bluish black lesions along with irregular margins, then what would that be? What kind of tumor would that be of the testes? That would be a teratoma. Okay, so testes means they will ask you only two specimens. First one, you should be able to identify spermatic cortex. So this is testes. Blending with the margins of the testes, homogeneous mass, it will be seminoma. And if it is variegated appearance with irregular margins, then it is teratoma. Okay, all right. Next one. First, identify the organ. Then tell me what is this. Intestine, very good. And what is this that you can see over here? Telescoping. This looks like a telescope, correct? So telescoping of one part of the intestine into another. What is this called? Yes, absolutely correct. So whenever you have telescoping of one part of the intestine into other, this is nothing but your intussusception. Okay, intussusception. Now, can you tell me what is the most common site of intussusception? Most common site of intussusception? Yes, ileocecal junction. Absolutely correct. Ileocecal junction. Okay. Now the easiest picture that you would get to identify, easiest specimen in the exam. Very good. So this is your gallbladder and you can see that there are these cholesterol stones inside. Okay. So this is your GB with stones. ये तो सबको identify होना चाहिए easily. Okay. Now let's come to the next picture. This one is interesting. First, tell me what is the organ? What is the organ that you guys can see in it? So this is your ovary, correct? So this is our ovary. And what can you see over here which is very, very obvious? The specimen you must have been asked in your patho exam also. Yes, so you can see hair in it, okay? Hair, not a normal tissue. Can you see one more thing over here? Yes, you can see hair and you can see teeth in it, okay? So what is this? Hair and teeth present. This is benign cystic teratoma of ovary, okay? It is benign cystic teratoma of ovary. What is the other name of this benign cystic teratoma of ovary? Anyone? It is also called as dermoid cyst of ovary, correct? Yes, so it is also called dermoid cyst of ovary. So you can see that there is a thin walled cyst. You can see the wall of the cyst. It is a thin walled cyst. So when you open it up inside, you will see unnatural tissue like hair, teeth, all of that. There is another, if you have a protruding thing coming out from one end of the cyst. Now it's not there over here, but what is that protuberance called? Very good. So that protuberance is called as Rokitansky protuberance. Okay. Now, what is the question that they ask? Suppose thyroid tissue is present, like hair and tooth. If you have thyroid tissue in the ovary, what is it called? Yes, it is called as struma ovary. And how will you know when it is malignant? How will you know that this dermoid cyst is malignant? Here I am telling you it is a benign cystic teratoma. How will you know it is malignant? I always told you, malignancy के लिए हमेशा there will be red necrotic bluish, not bluish, sorry, red blackish necrotic tissue. Okay, this is when you know that there is malignancy developing in it. Otherwise, this is a benign cystic teratoma. Okay, all right, next picture. This is uterus, very good. And what can you see in the uterus over here? It looks like a whirl, correct? This is also called as a whirl appearance. Whirl, like a cyclone, whirl appearance. Very good. So this is fibroid. Tell me the medical name for fibroid. Don't tell me fibroid. Okay. Yes, you can say fibroid, but in your exam, they will give you option as leiomyoma of the uterus. Okay. So this is an example of leiomyoma of the uterus. Is this leiomyoma, as you see, it is protruding into the endometrial cavity. So this will affect the growth of the fetus if this patient becomes pregnant. Okay. So leiomyoma of the uterus, it is also called as smooth muscle tumor of the uterus. Okay. Okay, and this appearance you should know on cut surface. What is this appearance that you see? It is called as the whorl appearance. Okay, now tell me what are the 3 positions of a fibroid or 3 locations of a fibroid and their classification. Yes, so you'll see a whorl appearance because of arrangement of the muscle. So what is the, yes, so you can have a subserosal, you can have a intramural, you can have a submucosal, and you can have a one more type of fibroid, that is your cervical fibroid. Okay, so these are all our different types of fibroids. Now look at something very similar over here and tell me what is this. I'm telling you this is a cut surface of the uterus only. Okay, this is a cut surface of the uterus, but you're seeing these multiple lesions. So what are these? Yes, so this is called as multicentric leiomyomas. Okay, you have multiple lesions, so this is called as multicentric leiomyomas. You can see small fibroids everywhere. Okay, now question that is asked in the exam: what are the secondary changes seen in leiomyomas? What are the secondary changes seen in leiomyomas? Give me any 3-4 secondary changes. Very good. One is red degeneration. Any other type of degeneration? Calcification, very good. One more type of degeneration. Malignant transformation. So when it becomes malignant, you call it as leiomyosarcoma. Okay, leiomyosarcoma. And one more type of degeneration, and that is your hyaline degeneration. Correct? Okay. Let's move on to our next picture. You can see the uterus. You can see the adnexa on bilateral side. But what is the problem in? Very good. So this is your CA cervix. Okay, you can see there is this. Now you all understood how to identify a tumor on gross specimen. Now I told you it will be reddish, bluish, blackish, dirty appearance. Okay, so this is, now you can see reddish, irregular margins, protruding tumor, and which area is this is in? This is in the cervical area. Okay, so this is CA cervix. Okay, so now what is the risk factors for CA cervix? Give me risk factors for CA cervix. Cervix. Smoking, okay. HPV, very good. That is the main risk factor for CA cervix. Then sexual activity at early age and multiple sexual partners. Okay. Okay, now this one, I am putting the next picture to test you guys. I have already asked you this image, but now I'm showing you a different kind of image of the same thing. So let's see if you will be able to identify this. Yes, okay, very good. You all are too smart. Okay, so this is your seminoma. How did you identify it? Spermatic cord attached, looks a little bit like the thyroid, but it's not exactly butterfly shape, and you can see that there is a mass inside which is homogeneous and it is blending with the margins of the testes. Okay, so this is nothing but a seminoma of the testes. If there was any necrosis or variegated appearance, then this would be what? This would be teratoma of the testes. Okay, all right. How do you see this growth? Ulcerated, fungating, and it has a very common name. Okay, very peculiar name. Cauliflower-like growth. What is this? Yes, this is CA penis. Absolutely correct. Sometimes they will show you a cut surface of the CA penis. So aisa they will cut it. Okay, in the coronal plane, and you will see that the tumor is infiltrating into the penile urethra. Okay, but इसमें दिखाया नहीं है. इसमें you can see the proper dirty cauliflower-like growth at the end of the penis, and that is example of CA penis. Okay, what is the protective factor for CA penis? Anyone? Okay, circumcision. If you had to choose what kind of cancer this is, can you tell me? According to you, what do you think? Yes, absolutely correct. So most common squamous cell carcinoma of the penis. Okay, all right. Everyone knows this is kidney. Ureter लेकिन cut कर दिया इधर. But tell me, what is the difference between this part and the rest of the part? No, this is not FIO. It's not RCC also. Okay, so I'll tell you this because this is a little complicated. So basically it's showing that this part of the kidney is very pale. Okay, so this is nothing but the infarcted part of the kidney. So you should know whenever you see like particular areas, not large white kidney, we saw it was amyloidosis. There was homogeneous deposition of amyloid over there. Okay, but here if you see certain areas where there is pale area, okay, so you should know that there is an infarct. Okay, don't worry about this. This picture actually I just put it just for reference. Chalo, ye batao, dirty picture. There is foot, and foot mein you are seeing cauliflower growth again. So we have discussed what does cauliflower growth appearance tell you? Yes, this is squamous cell carcinoma of the skin of the foot. Okay, squamous cell carcinoma of the skin of the foot. Whenever you see all this cauliflower like growth, it is SCC. Okay, all right, next. This one they can definitely ask you in the exam. There is a fetus and there is a placental tissue, but this is not a normal placenta. What is this? Very good. So this is nothing but hydatidiform mole. Okay, hydatidiform mole. I forgot the spelling. Okay. Yes. So whenever they show you small picture of the fetus and they show you the placenta, in which you can see that there is not exact complete hydrops degeneration, but little bit is there, and it does not look like the normal placenta. This is your hydatidiform mole. Okay, and last picture for today. Identify gross specimen. Long round worm. Long round worm. Very good. This is Ascaris lumbricoides. Okay, Ascaris lumbricoides. So I'll quickly show you all the pictures that we have seen till now, all the gross specimens that can be asked in your exam. So second year pathology and final year surgery ka acha revision ho gaya. This is punched out lesion of gastric ulcers of the stomach. How will you identify the stomach? From the rugosities. Okay. Then here you have the kidneys. How will you identify kidney? From the ureter and hilar blood vessels. You can see they are fused at the lower pole. So this is polycystic kidney. Here you have your butterfly shaped gland. So when you see your butterfly shaped gland and you can see multiple nodules in between. So this is nothing but a thyroid gland with multinodular goiter. This is our kidneys with multiple cysts. So this is polycystic kidney disease. This is the breast. Breast made two kind of lesions. How do you identify the breast? By the nipple and the areola. Then two kind of lesions are possible. Homogeneous single lesion, fibroadenoma, and if it is a variegated appearance, irregular margins, ulcerative, infiltrative, that will be your CA breast. Okay, this is per the orange of the per the orange lesion of the breast. I think this per the orange had come in this year's FMGE exam in June. Okay, so blocking of cutaneous lymphatics by tumor cells will cause this per the orange appearance, and you will have nipple retraction whenever the suspensory ligaments of Cooper are involved by the tumor. So all these are seen in CA breast. Then this is a large white kidney commonly seen in amyloidosis and RPGN. This is a small shrunken kidney commonly seen in CKD and benign nephrosclerosis and chronic pyelonephritis. This is upper pole of the kidney appearing brownish, blackish, variegated appearance, RCC. This is cavitatory lung lesions seen in cavitatory TB. Then this is our small white opacities that you can see. So these white opacities is nothing but our millet shaped appearance. Okay, so then after that you have this over here, lobar pneumonia. You can see this is gray hepatization of the lung. Then we have this spermatic cord attached over here, so we can identify that this is an example of the testes. And testes may you can see the mass over here, it is homogeneous blending margins with the rest of the testes. So this is an example of seminoma. If it was irregular margins and not blending with the rest of the testicular tissue, it would be a teratoma. This is telescoping of one part of the intestine into another. It is intussusception. This is our gallbladder stones in gallbladder. This is thin walled cyst of the ovary with hair in it, tooth in it. Okay, so this is nothing but dermoid cyst or benign cystic teratoma of the ovary. This is whorl shaped appearance in the uterus. So this is leiomyoma of the uterus. Then after that, we have multiple ball-shaped appearances in the uterus. So this is multicentric leiomyomas. Then we have this uterus ka picture over here with the growth in the lower part of the uterus. So that is the cervical cancer. Then we have again over here, as I have shown you all guys. Why are all guys coming so late? Palak, INI, CET, Dr. Sai. Why so late for class? Nala Patti, Divya, many people have joined late. Okay. Did you all get the notification now? Okay, so this is again pictures of the seminoma of the testes. Spermatic cord can be seen easily. This is a cauliflower-like growth at the end of the penis. So this is nothing but squamous cell carcinoma of the penis. This is infarcted kidney, wedge-shaped lesion, pale in color. This is squamous cell carcinoma, cauliflower-like growth in the foot. Okay, and this is a picture of fetus with a partial mole of the placenta, you can see. So this is hydatidiform mole and long round worm. So this is Ascaris lumbricoides. Okay, so all the gross specimens that can be asked in your exam. I hope that this was useful to you. You can download it and you can watch these pictures later. Okay, so tomorrow we will be doing pictures from toxicology. All right, tomorrow's pictures from toxicology will be discussed. Chalo. Bye bye, good night. And there is one more class that we have at 10 o'clock, 10 p.m. tonight on YouTube, and that is image-based questions in short subjects. Okay. Now, before we go, guys, please give me some ideas as to what topics you want covered in this 30 minutes, 30 images. Any subject is okay, any topic is okay. But I mostly want to give you all novel topics that will not be covered in any of your classes or in any of your notes or books. Torture method images, okay, that sounds scary. Microbiology images, okay. So this TMTI series, we are going to be having it at 8:15 every day of this week. So we are going to be discussing all the images that are there. Instruments, yes, I'm going to be putting instruments of surgery, OBGY, all of them. Micro, subject-wise PYQ images, okay, fine. All right. So what are the subjects that you're mostly interested in? Final year subjects or second year subjects? Next class at 10 p.m. we have a YouTube class on image-based questions in short subjects, that is in skin, anesthesia, radiology, psychiatry, orthopedics. And my Telegram group, you can message me on Telegram. I will add you to the group. Okay. I'm available on Telegram. You can message me on Telegram. I will add you to the group. Okay, final year subjects ka pictures. All right, fine, done. So we'll do that. All right. So take care, guys, and I will see you. So 10 o'clock we have YT class on image-based questions and short subjects, and tomorrow again 8:15 we will have 30 images in 30 minutes, and that will be at 8:15 p.m. only. And this tomorrow we'll be doing images from toxicology. Okay. All right. Bye. Take care.